The gut-brain axis is one of these things that we're only recently learning to
Right.
understand. But really, I would say that we understand very much that the gut is related to hormone production. So we know that that's really important through midlife and other parts in our lives where our gut and our hormone system is very closely related. Your gut is very closely related to cortisol production. It's very closely related to other neurotransmitter productions, like, for example, GABA, which gut bacteria produce GABA, and GABA helps to stop stress hormones from being able to attach in your brain. So if you haven't got enough GABA because your gut bacteria aren't doing their thing, you're going to be anxious all the time. You're going to be really struggling, and that anxiety can be really self-perpetuating. And if we
Yeah.
can improve that stress by looking after the gut, then other stress conditions can be reduced. And we understand now how much more stress is related to things like inflammatory conditions, and the gut is related to inflammation within the whole of the body. And so if we can support the gut, we can reduce inflammation across the body and hopefully look to prevent things like diabetes, heart disease, lots of these inflammatory conditions that perhaps we didn't see as inflammatory conditions in the past.
I'm Shreya Parekh, and this is Empower Her, the podcast for women over 35 who want to take control of their health and wealth. Join me and my guests as we share insights, resources, and ideas to help you break free, learn more about yourself, and live your best life while closing the gender gaps. Hit follow to stay connected and sign up for free emails on the Empower Her website to supercharge your journey. Today, we're diving into the world of gastrointestinal and colorectal health with Sophie Medlin, a highly respected consultant dietitian and chair of the British Dietetic Association for London. Sophie brings extensive expertise, having worked in acute hospital settings, specialising in gastrointestinal diseases before transitioning to academia as a lecturer at King's College London. She's also a trusted media spokesperson, frequently featured in print, broadcast and social media for her evidence-based approach to nutrition. Get ready for an incredibly insightful conversation all about your gut health. Sophie, thank you for joining me today. I'm super excited to talk about the world of gastrointestinal and colorectal health, and to tell my audience what that is exactly about. Could you please introduce yourself and talk a little bit about your journey from what you were doing to what you're doing now? That would be great. Thank you so much.
Absolutely. Thank you so much for having me. So I was a strange 15-year-old child who knew I wanted to be a dietitian, and I feel so lucky that I did, because it's been a fantastic career for me. So as most dietitians, for those who don't know, the difference between dietitians and nutritionists, for example, is that dietitians are the medical nutrition people. So as part of our degree, we do a degree in nutrition, but we also go on to learn how to apply that to medicine by going on lengthy placements in hospitals and working alongside doctors and nurses and the rest of the medical team to understand exactly how we can use nutrition, the science of nutrition, and apply it to medical conditions. So that could be anything from tube feeding and intensive care to helping someone with renal disease or kidney disease manage the levels of different electrolytes in their bloods, for example. I then went to work in the NHS, which most dietitians do, of course. I was in the NHS for about 8 years, eventually specialising in intestinal failure, so when the gut doesn't work at all, and colorectal surgery, so when people have to have parts of their bowel removed for various different reasons, including colorectal cancers and things like that. And that's very much been my passion moving forward. So clinically, I'm a consultant colorectal dietitian. And I also, after my NHS work, I started a private practice and was a lecturer and researcher for 5 years at King's College in London, which was a fantastic experience, but I decided it wasn't the sort of right environment for me. And I now run my clinic. So I have a team of dietitians under the brand City Dietitians. And we see hundreds of patients every month, and we're very lucky to have a good network of people that we're looking after. I also design and formulate multivitamin and probiotic products. So in my consultancy, that keeps me busy. And I'm lucky enough to do some media work as well. So if people want to see what I do in action, you can watch that on Channel 4's Know Your Shit programme, which is still available on the 4OD player.
That's fantastic. That is a lot of things that you do.
It keeps me busy.
Thank you for explaining the difference between a dietitian and a nutritionist, because I think those lines can get quite blurred and people assume they're the same thing, and or sometimes perhaps not. But a lot of people, including myself, I didn't actually know what the difference was in detail, like you explained. So could you just explain a bit about what gastrointestinal and colorectal health means. What does that involve exactly?
Yeah, so as you can imagine, every part of your digestion, you've got a very long digestive tract. There's a huge amount of tissues there that are doing very important jobs, from things like your gallbladder, which helps you digest fat. Pancreas helps you to digest fats and protein and carbohydrates and other things. And as we travel through the gastrointestinal tract from really the esophagus down, different things can go wrong at different times for various different reasons. So if we take something in the upper digestive tract that most people might be familiar with, something like reflux, so having kind of acid reflux, heartburn, that kind of thing, which some people have occasionally and other people get really chronically, and it can actually in its worst form lead to things like esophageal cancers and things like that. So it's something if you get it occasionally not to worry about, but if it's something that becomes more chronic, it's definitely something to get looked into, and diet and lifestyle plays a role in the management of that. And then as we move through the small bowel, that's really where we absorb most of our nutrients. And then we move into people can get an appendicitis, for example. That's something that if it becomes problematic, dietitians can support with. The colon is a area, so colorectal, so in terms of colon and rectum, those are the things that I really specialise in. And lots of things can happen within the colon that aren't so helpful for us. So things like colitis, where there's inflammation, sometimes that's ulcerative colitis, where it's an autoimmune condition. And then also things can go more kind of things that people understand are things that can go wrong with the rectum. So things like piles, fissures, hemorrhoids, those sorts of things that can affect people. I treat a huge amount of women who have had problems with their pelvic floor through midlife, possibly after traumatic childbirth, but not necessarily. Where defecation, so going for a poo, becomes more of a problem. So essentially, I spend my whole professional life talking about poo, Shreya, which sounds like a funny thing to do, but actually it's so fulfilling, because if you imagine somebody whose bowel function means that they really have to know where every single toilet is, where, if they're going to leave the house, they have to really plan things out. They can't really travel by tube or public transport because they're scared of having an accident. We can take people from that to living a full life, going out for dinner with their friends, enjoying themselves and going out for runs and the things they love to do and not feeling fearful. It's a real gift and a privilege to be able to support people through that. So it's something that I really love. And it's a very niche speciality, but I love it.
Yeah, and look, it's an important part of our health. Ultimately, everyone goes for a poo.
Yeah.
Well, everyone should be going for a poo, and it's knowing really if you're not going, or if something's not right when you are going for a poo, what those things are, because it can be quite serious. And also when women are transitioning, going through perimenopause and postmenopause, things down there can be quite different. So can you explain to me how this is linked to gut health? Because from my point of view, what I'm thinking is what you eat obviously affects your gut health, and in turn affects your shit, basically.
Yeah, absolutely. So when we think about gut health and the way that the sort of public facing world, I guess, now is talking about gut health, is to talk about the microbiome, so the good bacteria that we have living in our colon. And there was a really interesting piece recently about how someone was saying that if aliens came down to Earth, they would view humans as a hybrid species of bacteria and human, not as a single entity. And that's because we do live with these billions of bugs in our gut all the time. And those bugs are either working for us or against us. So they're either supporting our health or driving us to ill health. And they don't have any bad intentions for us. It's much more to say that what we eat and the way that we take care of them impacts whether there's more of the good guys doing positive things for us, or there's more of the less positive bacteria that are doing less good things for us. So taking care of the structure and function of your colon and your rectum, as well as the rest of your gastrointestinal tract, is really important. But also we need to take care of this microbiome which exists within us. And as we go through midlife, for example, what we know to be true is that the diversity of good bacteria reduces within the body. And that's diversity really is the key point towards thinking about what benefits our health. So the more diverse our gut bacteria is, the better our health outcomes are. And diversity comes from eating a good variety of plant foods. So fruit, veg, whole grains, nuts, seeds, pulses, all of the plant foods you can imagine. And not necessarily to the exclusion of animal foods at all, just that those plant foods are what those guys really like to eat. But going through midlife, that diversity can decrease, and that can push us into a space where we're more prone to things like heart disease, diabetes, and other problems. So it really is, particularly through midlife, a great time to think about gut health and supporting your gut bacteria so that you can prevent some of those preventable conditions that we know our gut bacteria are either supporting us to prevent or potentially pushing us towards.
Yeah. So, if you are in midlife or at any stage of your life, really, how do you know about the diversity in your gut, and how do you know if you have poor gut health?
Yeah, so the things that I would look for to understand how well someone's gut bacteria are functioning, but also their general gut health is behaving, would be to think about how often they're going for a poo. Is it every day? Is it not frequently enough? Is it too frequently? So we think of normal as being between 3 times a day and 3 times a week. So basically, as long as you're having your bowels open less than 3 times a day, or at least alternate days, you're in a relatively good space. We want the poo to be soft and easy to pass. We don't want you to be sitting on the toilet struggling to pass those stools, whether they be soft or hard. If they are soft but difficult to pass, that points to kind of pelvic floor type dysfunction, which we can support with, obviously. So we want to be thinking about what the poo itself is like. Are you getting really bloated and uncomfortable? That's something to look out for. And lots of women through midlife would say, or at any time really, depending on what's going on with the microbiome, would say, oh, I used to be able to eat this food and be fine. And now suddenly when I eat it, I get really bloated and uncomfortable. And that's a sign that something's changed within your gut bacteria that we can address and we can sort out and get you back to where you were before. Either if people come to me quickly when the symptoms come on, we can reverse it quickly. If it's been there for 10, 20 years, sometimes longer than that in the patients that I see, then actually it takes a bit of a longer time to reverse those changes. So gas is another thing. So some people find that, particularly through midlife, but in other stages as well, suddenly they're producing loads of excessive gas, as in farting a lot. And sometimes one of the questions I would ask them is it particularly foul smelling? So if you're passing lots of smelly gas, that's a sign that actually there's an imbalance with your gut bacteria, favouring the species that produce methane and sulfur, which make our farts smell bad. And so we can again redress the gut bacteria balance to make that better for you in the longer term. So things like gas, bloating, change in bowel habit, these are the sorts of things that you want to say, okay, there's probably a change in my gut bacteria. And that can be just a natural evolution of your microbiome, or it can be more commonly linked to either acute or chronic stress. Gut bacteria do not like stress, and that helps to sort of dampen down the populations of good bacteria and create imbalance in the gut. It can be because you've gone on a crazy diet. So I see lots of people who are what I would say in keto diet rehab, where their gut bacteria has really suffered from cutting out those whole grains and those healthy things that we know are great for our gut health. Similarly, I see lots of patients who've perhaps a few years ago, perhaps more recently, gone on like a meal replacement type diet and just had milkshakes for a while. And of course, your gut bacteria really suffer in that situation. You can lose a lot of weight, you almost always regain it, but ultimately your gut bacteria are going to suffer. And then things like antibiotic use and that sort of thing can be something that really triggers a change in your gut bacteria that is detrimental to your gut function and ultimately your gut bacteria themselves. So these are sorts of things that I would look out for in terms of signs and symptoms of something not being quite right with our gut bacteria or with our gut function itself. And that, again, those are things that there is help for. And some people I speak to will say, I've been to my GP and they say it's just IBS and go on and manage it, when in reality, you don't have to live with these symptoms. There are things that we can do as dietitians to support people to make things better.
Talking about IBS as an example, sorry about that. Talking about IBS as an example, because I have IBS, so that's why I'm going to, talk about that as an example. If you have been told you have IBS, now I've seen on Instagram, on social media, that IBS is linked to brain stuff. Now you can control it through hypnotherapy. It's not really something going on in your stomach and food intolerances and things like that. What's your view on that?
Yeah, I mean, so now IBS, so irritable bowel syndrome, which affects something like 20% of the population. So it's a very common condition. And the way to diagnose IBS, just in case people don't know, is through elimination of other things that it could be. And unless your GP or your consultant's gone through that elimination process, we can't say for sure that it's IBS. So lots of the patients that come to see me say, I've been told it's IBS. Well, have you had this test? No. Have you had this test? No. Then we can't say for sure it's IBS. Yeah. And that doesn't mean we can't treat people. We just write to their GP and say, can we have some more tests here? So IBS is we need to eliminate anything like inflammatory bowel disease. We need to eliminate something called celiac disease, which is like an allergy, not quite an allergy, it's an autoimmune condition related to gluten. And we also want to rule out bowel cancers, of course, and there's simple tests that GPs can do, blood tests and stool tests, that can rule those things out, and then we might say, okay, this is irritable bowel syndrome. Now, irritable bowel syndrome, previously we thought it was only linked to gut bacteria and changes to gut bacteria that drive the sort of intolerances to food, and I can speak more to that in a moment, but we have recently understood that actually it's a dysfunction of the gut-brain axis. So it's a dysfunction between the gut and the brain, and that leads to something called visceral hypersensitivity, where you may not have any more gas in your digestive system than somebody else does, but still you really notice that gas and you feel very uncomfortable. And the way that they've measured visceral hypersensitivity in clinical research is to put balloons up people's bottoms and inflate them. And the people with IBS say ouch much more quickly than the people who don't have IBS, because they can really feel that sensitization to things in their digestive tract moving through. I believe very strongly, and I've spoken to the company who say hypnotherapy can fix it and it's not about food, that actually it's a dual thing. So there are changes to the gut bacteria that are driving excess gas production. We know this to be true because many patients with IBS are very successfully treated by something called the low FODMAP diet, where we reduce fermentable carbohydrates for a period of time and then reintroduce them one by one. And what we almost always find in that scenario is that people with IBS are sensitive to things like onions and garlic and pulses and that sort of thing. But what's really important is that people don't eliminate those things forever, because the microbiome is changeable and we can improve the microbiome, get it back to where it was before, and then you can reintroduce those foods successfully in the long run. What I find is that people try and do that on their own, and then they end up in a situation where they've cut out dairy forever and now they've got osteoporosis, or they never eat onions and garlic, which makes it almost impossible for them to eat out with friends and have a nice, enjoyable social life and relaxed social life, which is really important. That said, alongside that treatment that I do with my patients, I will absolutely talk to them about the gut-brain axis, because it is such a valuable tool to help us to reduce the symptoms of IBS. And lots of my patients, one of the questions I'll ask them is, do you think that stress makes your symptoms worse? And almost all of them will say yes. And that's a really strong sign that that gut-brain axis is absolutely playing a role in what's going on with those symptoms. So gut-directed hypnotherapy is super useful. Gut-directed yoga is really useful. Gut-directed meditation is amazing. And breath work is really useful. So there are loads of ways that we can help to calm that connection between our gut and our brain and help to reduce those IBS symptoms without changing what we eat necessarily, and certainly without cutting things out. But for most of the time, a dual approach between techniques and exercises to support the gut-brain axis and improving the symptoms works the best for people, because people need to see results and to get better quickly, especially if that IBS is really ruling their lives and causing limitations to their quality of life.
Yeah. Would you say that the gut-brain connection can help with other illnesses?
Look, I think the gut-brain axis is one of these things that we're only recently learning to understand. Right. But really, I would say that we understand very much that the gut is related to hormone production. So we know that that's really important through midlife and other parts in our lives, where our gut and our hormone system is very closely related. Your gut is very closely related to cortisol production. It's very closely related to other neurotransmitter productions, like, for example, GABA, which gut bacteria produce GABA, and GABA helps to stop stress hormones from being able to attach in your brain. So if you haven't got enough GABA because your gut bacteria aren't doing their thing, you're going to be anxious all the time. You're going to be really struggling, and that anxiety can be really self-perpetuating, struggle to sleep, all of those kinds of things. So although it seems like the gut might be quite isolated and it's only IBS, there are so many wider conditions that are impacted by stress. And if we can improve that stress by looking after the gut, then other stress conditions can be reduced. And we understand now how much more stress is related to things like inflammatory conditions, and the gut is related to inflammation within the whole of the body. And so if we can support the gut, we can reduce inflammation across the body and hopefully look to prevent things like diabetes, heart disease, lots of these inflammatory conditions that perhaps we didn't see as inflammatory conditions in the past.
Yeah, well, so it's not really all just about the food that you're eating, there's a lot of things to consider, which makes sense really, because it's kind of, yes, you can improve your health through diet, but if you're eating the diet that you should be eating, lots of plants and different varieties and things like that, but then your stress levels are up here,
Yeah.
you're kind of contradicting, I
Yeah,
guess. Yeah.
totally. And it's about these pillars of health that we sometimes speak to, isn't it? So movement or exercise, depending on your capability as a person. Some of my patients are quite disabled, and so they can't do a lot of exercise, but there's some sort of movement that most people will be able to do. Movement, stress management, sleep, and nutrition. And it's really easy actually for us to neglect all the other ones and just focus on nutrition. Not as a dietitian, I mean, we're generally pretty highly trained to make sure we're taking care of all of these parts of our health. But with nutrition, people can get really fixated. So a good example again is this sort of liquid diet type thing. So if you're doing a liquid diet, a meal replacement diet, you're not eating out with friends, you're not enjoying yourself, you're probably not feeling great all the time, you're probably not sleeping very well because you're really hungry, and you've probably not got enough energy to exercise. And suddenly all of those other pillars fall out the window because you're not socializing with your friends, you're not going out, you're not managing your mental health very well. And so we have to really think about nutrition as part of a sort of package of things that go together to support people's general well-being and overall health, as well as their nutritional health. And if people become super fixated on food, it really is to the detriment of other aspects of their health. So we have to, as dietitians, work really hard to sometimes undo the work of other healthcare professionals or the individual themselves who's done far too much research and is cutting out all these things from their diet and restricting themselves. We have to undo some of that work and then work to sort of dampen down the anxiety around food so that we can optimize those other pillars of health and make things better for people.
Yeah, no, definitely. So if you're going through midlife and having, perimenopausal or postmenopausal symptoms, now, I think a lot of the time we just think, oh, I'm just perimenopausal. That's why I've got, constipation or bloating or diarrhea, whatever that might be. Are there things that can be done to alleviate those things? I know I'm not talking about HRT and things like that, but in terms of gut health and what you're putting into your body and your expertise, basically, what you do.
Yeah, absolutely. And I think one of the things that's really important to remember is that HRT is going to be much more effective and much more make a bigger difference to your life if you're also looking after your diet and your gut health and you're doing the other things as well. So I think we're such a society and culture that's so keen just to pop a pill and think that the problem's solved, or stick a patch on and think the problem's solved, when in reality, it still requires us to do the other things if we want to have the best possible outcomes. Yeah. So looking after your gut health, there's some amazing research that's come out recently to show that certain gut bacterial species help to recycle estrogen within the gut. So estrogen that comes through into the colon normally has been deactivated, but there are certain gut bacteria that can reactivate estrogen and allow it to pass back into the bloodstream. And we think that those women who have more of those gut bacteria have a less harsh menopause, which you can imagine, because if you're able to upcycle estrogen again, you're not having that huge crash that some people really experience. So we're learning more about this all the time. And I should say, really importantly, if you do have a change in bowel habit, so changing from having firmer stools to having looser stools, or from looser stools to firmer stools, that would be called a change in bowel habit, and your GP would want to know about that, especially if it lasts for more than 2 weeks. That is a sign of something not being quite right in the gut. And they might well say, oh, it's nothing to worry about, which is great news, but ultimately it's not something you have to live with. And looking after your gut health at that point in your life is a great time to think about it, because then all of our good bacteria can be doing the things we want them to be doing for us, including helping to manage inflammation, upcycle estrogen, helping us to manage our stress levels, improving our sleep, all of these things that really become niggling problems through midlife that we can help to suppress and manage by looking after our gut health a little bit better. So if that's something that people feel motivated to do, it's a great time to start thinking about it and doing it.
What would you say would be your kind of top pieces of advice in terms of, not just nutrition, but just making sure that you're looking after your gut and your gut health? And also, if you're going through that midlife, what can you do? I know you mentioned, it's not just about what you're eating. There are other things you need to do. But what would be your kind of top piece of advice for people that, you know, we're living it, like you said, you know, we want instant results. You know, we want everything now, and if we don't get it now, we give up or get bored and don't,
Yeah.
you know, do the things that we should be doing. And we're busy. A lot of people are busy. You know, that it's a time thing because we're probably overworked, stressed, and all these things, you know, come into play.
Yeah, absolutely. So these tips apply for anyone midlife or elsewhere because it's our gut bacteria like the same things, whatever life stage we're in. So eating a good diverse range of plants is really important. Let me do that again. Eating a good diverse range of plants is really important. And that can be as easy as having a bag of stir fry veg rather than just eating the same veg on repeat, for example. Or buying a bag of mixed salad. If you're really under pressure, buy a bag of mixed salad or a box of mixed salad so that you're getting lots of different plants in the same meal as opposed to just chopping up the old lettuce that you've got in the fridge, right? So there's ways of making that easy. Another great tip for increasing variety is to think about the odd box type companies, you know, vegetable box delivery companies who will deliver you things that you wouldn't normally buy. And then if you're not sure what to do, then just put them in a soup and they'll be delicious. But it's about trying to increase that variety and not eat the same plants on repeat. So diversity of plants is really important in the diet. Start snacking on nuts, start adding seeds to things. Just topping up your plant points every day will make a difference. Spices and herbs count towards that as well. So that's really helpful to remember. So eating more diversity of plants is really important. Think about that stress management. What are you doing to support your stress management? And could you be doing more? Is it taking a few minutes to do? I was talking to somebody yesterday in clinic about just doing some guided meditation on the way home on the train, just taking 10 minutes to listen to something that helps to calm your cortisol levels, get you into a better space and get you ready for the relaxation of the evening and not feeling that you're taking that tension from work or home back home to where you're supposed to be relaxing and trying to unwind. And then sleep is super important. I think we often neglect this, and it's important or helpful to remember that your gut bacteria also have a circadian rhythm, so a body clock, the same way that you do. And when we fight against that and we're not getting enough sleep, our gut bacteria suffer. But also in general, we're just never going to be as well as we could be if we really focus on our sleep. That can be super difficult if you have young children or you have responsibilities that can keep you up in the night. But it is about trying to do the best that you can do to support your sleep hygiene and do as well as you can do with your sleep each night. And then exercise or movement is really important. So what can you do and how can we fit that into your week so that it becomes manageable and not something that feels stressful and pushes up your stress levels and makes everything else more difficult for you? And when can that fit into your day that you feel at your best to make the most of that and enjoy it? So those are the things that we would work on, and I think the things are really, really important to think about. And it is about, you know, working, if you can't do it yourself, and lots of people struggle, it's about working with somebody who can help you and support you through that and give you a bit of accountability that can make a big difference. But we can't do one without the other. We can't neglect everything. And there are loads of products and tests and services and all sorts of things out there at the moment thrown at people, particularly midlife women. And I think, you know, sometimes speaking to somebody and just unpacking what they really need and what's going to work for them is helpful because it's so overwhelming at the moment.
Yeah, exactly. Absolutely. There's so much out there. I think for me, in my point of view, it's getting a bit ridiculous with, you know, things like menopause chocolate and menopause this and menopause that and whatever. It's almost like, whoa, you know, do I need to take all these things? And I absolutely agree. You know, it is an individual thing. Your symptoms, everyone's symptoms and whatever. For anything really, it's going to be different, and it has to be more of a kind of personalized, bespoke approach to your health and to your health and fitness journey. I want to ask you about 3 things that I have heard, or you know, think, you know, we all listen to media and whatever, related to gut health, and can it impact your gut health in a negative way? That is alcohol, sugar,
Yeah.
and antibiotics.
Yeah, so alcohol for sure is not great for our gut bacteria. So a glass of red wine with your meal from time to time, fine, but it's very easy to push that beyond that measure and end up in a situation where you're causing more harm than good with the alcohol consumption. And there's this kind of trope, and I don't love it, but people suggest that women through midlife are drinking loads of white wine and red wine and doing all this harm to themselves. And I don't love that as this kind of stereotype. I don't think it's necessarily very accurate. But at the same time, if you notice that your alcohol intake is creeping up, then the most important thing is to make sure that you have at least 3 alcohol-free days a week, and try to limit the amount of alcohol that you're having each time. So try and drink within those kind of safer alcohol consumption limits, and don't sort of fool yourself into thinking that, oh, 2 glasses of red wine is good for me, when really, 1 small glass of red wine might be positive, but any more than that is not good for our gut bacteria. They don't like it. They also don't like sugar or any ultra-processed foods. So foods that contain added sugar often also contain emulsifiers, other flavorings, things like preservatives and that sort of thing. So too much refined sugar is not so great for our gut bacteria or for our general health. So we want to be thinking about, where are those sources of refined sugar in my diet and added sugar, and can I limit them a little bit? And as dietitians, we never worry about the sugar that's in fruit, the sugar that's in dairy, any of these natural sources of sugar we're not concerned about at all. But the added sugar, the sugar you add at the table with teaspoons or into drinks with teaspoons, sugar in fizzy drinks, for example, sugar in cakes and biscuits and pastries, those sorts of things that we're buying or making at home, that's the sort of sugar that we would want to be thinking about and trying to manage our intake of a little bit. And the same with ultra-processed foods. So we want to be looking at emulsifiers, preservatives, which are there to kill bacteria, so not so great for our gut bacteria, we think. Emulsifiers, preservatives, and things like flavorings and colorings and artificial sweeteners. Those are the kinds of ingredients that our gut bacteria really don't like. And what was the last one you asked me about?
Antibiotics.
Antibiotics, yeah. Antibiotics are really not great for our gut bacteria. So I see lots and lots of patients with what I would call an antibiotic-associated microbiome injury. And that means that antibiotics have caused real changes to the gut bacteria that have led to something like irritable bowel syndrome, or sometimes tip them into an even more serious condition, inflammatory bowel disease and things like that, or a flare thereof. Our gut bacteria are working really hard to manage inflammation in the gut and doing all sorts of brilliant things all the time. And all of us will need antibiotics sometimes in our lifetime. Unfortunately, I come from a generation, and maybe similar to you, Shreya, where they literally threw antibiotics at us as children. It was like any sniffle, give them antibiotics. I remember the banana amoxicillin and the strawberry amoxicillin and penicillin, all that stuff.
Yeah.
We have to be aware of that. And the NHS, fortunately now, as people will be aware, are much more resistant to giving antibiotics just for any old thing that's going on. But that said, all of us at some point may need antibiotics, urinary tract infections, for example, whatever it might be. And that's okay, as long as we think about taking some probiotics alongside the antibiotics, and for another week or 2 afterwards is a great idea, just to support your gut through that journey. And then also just trying not to, and some people will have to for various reasons, but trying not to end up in a situation where you're on cyclical antibiotics because you're consistently getting urinary tract infections, for example, or throat infections. We've got a big microbiome in our throat, we've got a big microbiome in the vagina. If you're struggling with these kinds of things, then it's likely that actually it would be a good idea to speak to someone like myself or another dietitian who can just see what we can do from a gut health perspective and from a microbiome perspective to get you off that consistent roundabout of antibiotics, which is probably sort of self-perpetuating the problem a little bit. Don't try and do that on your own, and always follow medical advice, of course.
Yeah, absolutely. You talk about probiotics. So how important is taking probiotics? And then I want to kind of lead on to the supplements side of things as well. I know that you mentioned, obviously, if you're taking antibiotics, maybe supplement that with some probiotics. But if you're not on antibiotics, is it a good idea to take probiotics? And what do you mean by probiotics in kind of natural form, supplement form?
Yeah, so probiotics are good, like supplemental good bacteria. So you're adding more good bacteria into the mix. And you can take those in things like fermented foods. The only one that's got any proof that it gets the gut alive is the good bacteria that's in kefir, so and dairy kefir specifically, not water kefir or plant-based kefir. But those good bacteria do seem to get to the colon alive, which is good news. So if you want to do something that's kind of natural in inverted commas, then kefir is a good idea. Otherwise, we're talking about probiotic capsules and products and things like that. And the best way to make sure they do get to the gut alive is to have a delayed release capsule. So all the probiotics that I formulate will be in a delayed release capsule, because we know otherwise they're just not doing very much, or as much as we want them to be doing. We don't know the answer as to whether people who are fine need to take probiotics. There is one theory that would say that because over the generations and with antibacterial hand gel and antibacterial house sprays and all this kind of stuff, that we are losing generationally losing good bacteria from our digestive tract, or species of good bacteria from our digestive tract. Even one generation ago, families would have been much more outside, gardening, in touch with the soil, in touch with the earth, maybe even in touch with animals, much more than we are now. So there is a working theory that maybe everyone should be taking them because we are losing species of good bacteria and it seems to be having a detrimental impact on our health. There is other people that would say if your gut function is absolutely fine and no problem, then don't worry about it. And I sort of sit between those two camps, really. If someone's taking one, I don't think it's going to cause them any harm at all, even if their gut function was fine to start with. If it's someone who does have any changes to their gut function, yeah, absolutely try a good probiotic and a delayed release capsule. But you don't necessarily need to take one if your gut function is fine. It's hard for individual people to choose a good probiotic because all the different strains that we have do slightly different jobs. And so it's about trying to be really specific about your symptoms and then choosing a product that has the right strains in for that particular symptom. That's not an easy thing to research and find out on your own. So I have sort of, a book of different probiotics I'll prescribe for different reasons. But that's not something I would expect general people to understand, because it's not easy to get between those kind of Latin names of all these different bacterial species.
Yeah.
So probiotics, really useful under the right circumstances. If you have no concerns about your gut bacteria or gut function, I should say, I would say probably don't worry about it. But if you have a look on, so Heights is one of the companies that I formulate probiotics for, and if you have a look at the reviews on their probiotics, lots of people say, well, I thought my gut function was great and then I started taking this and I didn't know it could be this good. And so there's something there for me about understanding that maybe people are living with symptoms they don't really know are symptoms. It's just what they think is normal for them, but it could be improved potentially with a probiotic. And with all probiotics, we would say take it for 3 months. If you've not felt any difference, don't continue with it because it's not working for you.
Yeah. What kind of things can probiotics help with?
So bloating, gas, things like that, changes in bowel habits. So it can reduce diarrhea or improve constipation. So either way on that spectrum, things can be improved. For some people, it might even improve a reflux symptom, so acid reflux and that sort of thing. It can improve mood. It can improve the vaginal microbiome and reduce the incidence of thrush and things like that. So there are loads and loads of things that can be improved with probiotics, with the right strains of probiotics at the right time.
Yeah. So is it, you mentioned Heights, is that something kind of more bespoke? So if I was having certain symptoms, as an example, okay, I'm perimenopausal, I get bloated, I get constipated, and a few other things here and there. Is it kind of bespoke to me, or is it a general kind of supplement that you take that will probably treat that anyway?
Yeah, so the Heights probiotic is a general probiotic, but it's particularly formulated for the gut-brain axis. So it's great for IBS. It's great for that midlife anxiety concerns, things increasing in that department, reducing cortisol levels, managing inflammation, supporting immunity, those kinds of things. So it's very much kind of targeted towards that, as well as reducing bloating and gas and, changes in bowel habit that people don't want. But, I formulate probiotics for other companies as well, which are focused on skin health and the gut-skin axis and other things. So it's about sort of trying to find the thing that's right for you. Yeah. But I think particularly for midlife women, that Heights, it's called Biotic Plus from Heights, is a particularly good product for supporting the gut-brain axis. And I'm a dietitian and I have to be transparent that I've got shares in the company and that, eventually one day I might get a kickback from recommending it. But ultimately it's a great product and I'm really proud of it.
That's great. So moving on to supplements, really.
Yeah.
Now, I was one of these people that used to take supplements for the sake of it, really, I think. And, I feel like the supplement industry is crazy in the sense that, people are just taking stuff for the sake of it, like I did.
Yeah.
What's your view on that? And how do you know when you should be taking a supplement? As opposed to I'm just taking this because I think it will help with this.
Yeah. So I suppose there are two camps with this. One is if you have a problem that you think a supplement might be able to help with, do some research about that and try not to buy into the marketing. There's a great public website called examine.com, which if you type in menopause supplements, it will give you really great research on whether they're actually going to help you or not, which ones and which dose and all of those kinds of things. So if you are thinking about a particular symptom or problem, you want to do a bit of research to understand whether the ingredient that you're considering taking is going to make a difference or not. Other people might just take a good quality A to Z multivitamin as what I would call like an insurance policy. So for those days where you've had to have a sandwich on the go at lunchtime and you've had to have, something quick for dinner that probably isn't meeting all of your nutritional needs, it will just fill in those little gaps in your daily diet that make things a little bit easier to make sure you're not developing deficiencies. As a dietitian, we would go through a full sort of screening check of your body and talking to you about whether you have any symptoms of nutritional deficiencies. And some of the common ones that we see would be mouth ulcers or sores in the corners of the mouth, for example, changes to the fingernails, that kind of stuff. I talk a lot to my patients about how the fatigue, for example, how are you feeling in yourself, energy levels, all of those kinds of things. So it really is about trying to look at your body and listen to your body and try and see what might be going on for you. It's really easy to buy into the marketing of vitamins and products like that. Some good kind of all-rounders would be an omega-3 product. So that needs to be either from algae or fish oil, which will support inflammation in the body, support your brain health, and support your cardiac health as well. So if you're not eating at least 2 portions of oily fish a week, definitely consider an omega-3 supplement. B vitamin complex is a good one for energy levels, especially if you're cutting out dairy or any animal products from your diet or reducing those in your diet for conscious reasons. So think about a B vitamin complex. And then really it's kind of vitamin D is the big one. So we have to be taking vitamin D during the winter months. Everybody should be, but the darker your skin, the more vitamin D you'll be needing, and the more important it is that you supplement vitamin D, particularly through those winter months and probably all year round, realistically. Aside from that, unless you are iron deficient and you've got symptoms of iron deficiency, or unless you've got any other symptoms that need to be looked at, there's nothing that we can say is like a definite safe thing for everybody to be taking all the time, because vitamin products are not benign, and we do need to understand that taking too much of some things is not great for us and can have side effects, and they can interact with medications and all sorts of other things. So we do need to have a sort of conscious view on our supplement cupboard and say, okay, what is helping me and what's maybe not helping me so much.
Yeah. So I know, you run a clinic called City Dietitians. What kind of things do you treat and look at, if someone wanted to come and see you for whatever issues?
Yeah.
Don't want to send the wrong people to you.
No, that's fine. No. So I'm really lucky because we've got a team of amazing dietitians. So if you have any problems, whether it's like a cardiac problem, a weight management problem, a gut problem, whatever it might be, we've got someone that can support you with that. I primarily look after people who have bowel problems or who are thinking about their gut health and are just not quite sure if they're getting everything right and they want to see what's going on. I also look after a lot of women, so women's health problems ranging from PCOS to menopause and all sorts of other things in between. I'm a member I'm on the board at the Endometriosis Foundation, which is a big charity for endometriosis. So I do a lot of work at endometriosis and adenomyosis. So I do lots of different things, but those are kind of my main specialities. But that doesn't mean that someone can't just say, hey, I just want to check that I'm doing everything right and I'm not missing anything in my diet, and I want to talk about supplements and do, that kind of foundational work of good health. And you can book in online through the website with myself or the rest of the team, or you can contact the clinic and we can find the right dietitian for you.
That's fantastic. Sophie, thank you so much for having this conversation with me. It's been really insightful. There's so much more that we can talk about, and I hope that we can kind of dive into details of different topics. I mean, you mentioned endometriosis and other conditions, and I think, I don't know, maybe you can just give a quick bit of info. Can you improve endometriosis symptoms or end up being diagnosed with endometriosis with your nutrition, gut health, things like that?
Yeah, so I could talk about this all day. It's a whole nother topic, but there's certainly some really interesting research coming out recently about particular species of vaginal microbiome, so good bacteria in the vaginal microbiome, and bad bacteria that may be linked to endometriosis. So we think there may be a link with microbiomes and endometriosis. More importantly, I think most women with endometriosis have so much information about diet thrown at them all the time, telling them to cut out dairy, cut out gluten, do this and do that. Actually, the best research that we have available shows us that following a largely Mediterranean style diet, which is really anti-inflammatory, is the best thing we can do for endometriosis. If you have bowel involvement with your endometriosis, then there are treatment diets that we can do clinically that can change your life and make things much better. So if you have bowel involvement with your endometriosis, do see a good colorectal dietitian. We will get you sorted and make you more comfortable. But ultimately, it is just about general good, healthy eating with endometriosis. and, trying to listen to your body and take care of it as best you can.
Yeah, no, that's great. Thank you. Like I said, there's so much we can dive into.
Absolutely.
Thank you, Sophie. Thank you so much.
Pleasure. Thank you so much for having me.
Thanks for tuning in to Empower Her. I hope today's episode has left you feeling inspired and motivated to make a positive difference in your world. Please follow the podcast and share it with anyone who will find it helpful. Until next time, keep striving for positive change and greatness for all women.